Okay, good morning. I assume there will be some more people coming in. Welcome to the Grant Seekers Q&A session number 2. Just a few housekeeping notes. This is being recorded, so you see that it's a live stream on YouTube. It's not actually being live streamed in this moment. It's being recorded on our YouTube page in a private stream, and then we will post it later. Since this is intended for organizations, we didn't find any particular value in live streaming it, but it is easier for us to edit in YouTube. Secondly is that if you do not want to be on the screen in this video, I have it so that all of the non-video participants are hidden. So if you keep your camera off, you will not be on the screen. If you have your camera on, you will be on the screen. And if you want to put a question in the chat, you may ask a question that way, or you may unmute your microphone and ask a question that way. If you have your camera off and you unmute your microphone, you still won't be on the screen when you ask your question, but we will hear you. I'm going to quickly answer a couple of questions that came in previously that we may need to re-clarify, and then also a question that numerous agencies have asked through email that I'd like to clarify. Number 1, what does inability to pay mean? Yes, we understand there actually is a difference between the meaning of inability and the meaning of unwillingness. So when we say as part of the board's policy, it is stated that funded programs may not reject somebody's services based on their inability to pay. We understand that agencies that do sliding scale might have policies that ask people to show income and have recommended payments amount based on their amount of income. I don't think that's something that the mental health board particularly wants to micromanage. So let's use best practices with your policies and make sure that we're comparing those against maybe what other agencies do and national kind of best practices in that space. Understanding the intent is that people with serious mental illness and substance use disorders in Winnebago County not be denied treatment, particularly on their inability to pay. So, but I think there is, of course, some ability for organizations to have a policy for that in some cases might say, okay, your income level dictates that you do have an ability to pay. It's just that you might, in this case, be unwilling to pay for this service. So, like I said, there's not a clear laid out path for you on that, but that is the intent and the principle, and hopefully each organization can navigate that with best practices and policy. And if you want us to ever review your policy or have the board review your policy, we would be happy to do that. Question number 2 that I would like to add some clarification to is that some organizations who have renewal programs like to think about how would I expand this or how would I add new components to it. And from our end, managing the grants, it is from both the program side and from our side, it decreases the administrative burden when we have organizations manage multiple components, multiple staff, multiple programs under one grant award. When we have multiple grants to the same organization, oftentimes it just increases the amount of administration without necessarily increasing the impact. So with that said, new applications go through a pretty rigorous review process to get to the point of approval. And so just adding in large new things into a renewal application, which has an abbreviated application and a less strenuous review process, is would not be completely fair to those that are competing for new applications. So if you have something, that's why we say within 5%, we understand there's increased cost and things. once you're starting to get above 5% increase in your renewal, or you are significantly changing the scope, you're adding a new priority area, you're adding some type of new service to it that previously wasn't there, then that would likely require you to, for that component that is new, to file a new application. Or also this year in the renewal application, there is a question that says, if you were to get increased funding, what might you do with that? So it would be the intent of the board not to leave funds unspent that we can spend. So the options for that are, if after reviewing all the renewals and all the new applications, there are remaining funds that have not been awarded that can be awarded, that we could go back and look at what some of those renewal applications propose that they could do with increased funding. But also you may complete an abstract. So if you have something new and you're like, okay, our program in year 1 and 2 was primarily focused on the traditional components of mental health treatment, supported counseling, psychiatric evaluation, medication management. But we understand that based on what we are learning, our clientele has a desperate need for supported housing, and we want supported housing to be part of our programming moving forward. That really should be filed in an abstract. Now, the board potentially could, after the abstract phase, say, yes, this fits with the renewal application, and merge the two at that point, or they might want to see the full proposal. So, but at this moment in time, let's let the board make those decisions. And I think try to please adhere to, again, I'm giving you the intent of things so that you can try to make the decisions that are best for your organization. But the intent is that, yes, if you've already been funded to do a program, you've proven that you are doing it well, you can go through this abbreviated renewal process. But if you're proposing something new that really hasn't been vetted through the rigorous kind of screening, then please go through that, like everyone else has had to do to receive their initial funding. With that being said, I will now open it up for additional questions. Looks like we have resources linked in the chat. So thank you, Nicole. Absolutely, the number one thing you want to look at is that funding resources page. There's probably more information than you need on that page. Certainly there is all the information you need on that page, aside from what, questions you might need answer about your specific program or situation. But general resources, we have a lot of information on that page: the strategic plan, the notice of funding opportunity, links to the application portal, actual PDFs of the application so that you can review that in advance before you start filling it out online if you want to distribute it throughout your agency and different people are collaborating on the grant. Recorded question and answer sessions will be linked on that site. So, I mean, seriously, everything that you need for this, you should be able to find on that one page. Okay. Yes, and the definition of community support was discussed at the last session. That is that is in the board's bylaws. Okay, that is the foundational philosophy of how, or conceptual model through which the board is funding programs. So definitely familiarize yourself with that. Read the strategic plan. There's also talk of what the target populations are, and the types of outcomes that the board is really trying to promote. Okay. Any questions? You can unmute now. You can use the chat.
Jason, I had a question. This is Joan. I had a question about capital expenditures, which is now potentially an opportunity for agencies to request. I saw that only listed in, I believe, was it renewals, or is it in both?
Capital expenditures really have always been allowable. So you can put them in your budget in the new or the renewal. Okay. Yeah. At the abstract level, we do not have a detailed budget. So for new applications this year, so that organizations do not spend, 70 hours on an application that maybe isn't really within scope of what the board's wanting to fund, that the abstract allows for you to spend a little bit less time to pitch that idea and then allow the board to say, yes, that's definitely something that we feel is within our priorities for this year. Or alternatively, there's also an option to say, no, but if you made this shift here, we would want to see that program, or just, sorry, it's completely out of scope. So with that, we're not asking for a detailed budget at the abstract level, just kind of a general, how much would it cost? And then if we then do take a full new application or merge it with a renewal application, we would then either get a detailed budget for the new application or ask you to give you the opportunity to update your budget for the renewal to include those new cost components.
That's helpful. Thank you.
And so, yes, capital can be included. With supported housing, we anticipate that there's probably capital expenses involved with that, whether it's remodel or new build. That is one of the major things that will be required to create more supported housing, from our understanding of what the community needs are and what the current conditions are. Any other questions? Is everyone just spying on each other? I saw more people on here.
Jason, I've got a question. Thanks for this presentation, and that you're right, the website has 1 million pages of information on it. Thank you so much for all of that background. Can you talk at all about whether there's value in either joint applications or support letters? So just for context, community center here is working on youth mental health programming through art therapy. And so we're trying to partner with the Arts Council and a couple other groups to do that. Do you prefer for the application to come just from one entity, or is there any kind of partnering application that you'd look for?
That's a great question. So collaboration is one of the scoring criteria that the board has in their scoring rubric. So it is considered. We also understand that it can be really complicated to manage a multi-organization grant, from both the fiscal agent side to, in some cases, our side trying to review the information. So I would say there's multiple ways to collaborate. So one way to collaborate certainly is to have a grant with multiple partners, and with multiple partner grants, there's a couple ways to do that. One is that a lead agency, the fiscal agent, who is required to manage the program fiscally and programmatically, would contract those services out to additional agencies. And we would expect and require that the fiscal agent follow their procurement procedures for that. In some cases, that has required the fiscal agent to actually issue their own requests for proposals, such as in the case of some of our county department programs. And so they have, after we've given them the award, then they've quickly done their own RFP, and then they've gotten proposals and they've selected a provider, and then they, basically produce an invoice as their evidence of expenses, and they monitor and manage the fiscal components of that. So that's one way to do it. Another way to do it is on those collaborative applications would be that each partner has their own budget basically within that program, that they're not contracted, but each person is submitting each month their evidence and their revenue and expense evidence, and then we kind of review that for each partner separately, and then give an overall check for the whole program. So we can get into more details with that if you're thinking you're going down that direction and you need any support, particularly if you get through the abstract round and go into a full new application. But then the other way to collaborate this year that is new is that there's a tool called Iris, and there was an information session for that linked on the website. So this provides the opportunity for all these agencies that we are funding and more agencies within the community to share information about what they are doing, hours of operation, intake criteria, and then make referrals to one another as well in the system. So I would encourage you to, irrespective of if your application itself is going to be collaborative, that you take a look at the Iris tool, because that's a great way to show collaboration, even if you're not going to have multiple agencies on your application. In terms of letters of support, so I would like to differentiate letters of commitment from letters of support. Going around town and getting letters of support from every elected leader is not something that goes into the scoring criteria. It's not something that influences the board's decisions, frankly. So getting a letter of commitment from a partner who says, yes, we're fully on board with this, and yes, we are going to give referrals to agency X, or we are going to give, we are going to partner with them on this particular component of the program. I'd say those are meaningful, but just the letters of support about, you know, the board has a very methodical process for making decisions. So those letters of support don't really necessarily fit into that. Does that answer your question, Violet?
Yeah, thank you so much. That is really helpful. I'm going to check out that Iris part too. Thank you.
Great. Good question.
There's another question in the chat, Jason.
Okay, so we're considering submitting a new proposal that is broader and crosses over multiple target populations and priority funding categories. In the application, it does allow to check all available options. My question is, can we submit a proposal that is broad in scope, in that the intent is for it to target multiple populations and priorities? Yes, absolutely. That's an easy one. A lot of our programs that are already funded have multiple target populations and multiple priority areas. And frankly speaking, we'd rather, again, have an organization doing multiple things under one award rather than different things under multiple awards, because it just administratively, it creates increased burden for the organization. It creates increased burden for us, and it does not have any additional impact. So it's not balanced in that way.
Hi, this is Joan again. And I appreciate the fact that the applications now are available in a PDF, and I would have maybe looked at that before I asked this question, but is there a link for the abstract? Like pages or amount, just a blurb?
Nicole?
Can you repeat what your question is? Like a link meaning?
No, a length of it.
Oh, I'm sorry, I understand. So well, when you go, because you're a funded partner, I know you already understand Foundant. So if you go into Foundant, you can open it right there to complete it. So in each section, it has suggested character limits. And so like proposal description, for example, is about 2,000. So not that you have to use that, but we're trying to make it be as abbreviated as it can, with the understanding you would provide as much information as you could. Does that answer your question?
Yep. Thank you.
Does the character limit include spaces? My understanding is that it does. Is that correct, Nicole?
I believe so, yes. But the abstract process is specifically created for abstract. So I gave the max amount in each section, so hopefully, because that's what the section is for, it's, you know, a letter of intent abstract, that people have enough room to be able to put their information in.
Okay, any other questions?
I'm also going to put my email in here, so if somebody does open one of the applications or starts working on the abstract and you feel stuck or have questions, please feel free to reach out and I can try to assist.
Yeah, one other thing about collaboration, I guess I didn't mention, is there's also an organization collaboration interest sign up, and you'll see that on that funding resources page under the Iris demo recording button. If you are wanting to collaborate with other organizations, but you don't really know at this point what organizations to collaborate with, you can sign up on that sheet. I can say that last year there were several collaborations that came together because they found each other on this collaboration interest list and they proposed collaborative applications together. And in some cases, I think Joan can give testimony to situations where organizations were able to help each other with, like, here's how you could do a risk management policy without actually even filling out an application together. It just became a place of like, hey, how do we, maybe an organization that's less established, you know, connect with someone that has been funded and say, hey, I don't understand this part. Of course, you can ask us those questions as well, but sometimes clinical program to clinical program, you might have a different conversation than you're going to have with us as the funding intermediary.
And I also, like about 10 minutes ago up in the chat, I did put the link to the sign up sheet if you're interested in collaborating. So if people need the direct link, it's in the chat.
Okay, anyone else? All right, well, this is our last kind of official, you know, scheduled part of the programming. So basically from here on out, it's work on your grants, and those are a hard deadline of January 18th at 5:00 p.m. Central Time. The grant portal closes then, for fairness to all applications. Again, with public funding, we are not making exceptions to that. So that is, don't wait till the last minute. I know every funder says that, and every grant writer rolls their eyes, and we wait till the last minute anyways, but get those applications in. We'll be available to provide technical assistance if the portal's having issues or you're having questions, but the closer you wait till that deadline, you know, the more risk there is with those types of issues. So get it in on the 17th if you can, a little bit early, but that is our deadline. And again, we remain available for technical assistance and questions as you go through this process. If you do a full review on the funding app resources page, you'll see in the funding policy that the board members make the funding decisions. We don't on the staff side. So we are commissioned to provide technical assistance to grants. We're not going to design your program for you, but we can help you navigate the portal and make sure that you're understanding the intent of questions so that you do have the best quality application possible as the board are reviewing those. So feel free to reach out to Nicole or myself, and we can try to help you with those answers. Okay. Last call, and then we're gonna end the session. Okay. Thanks everyone for attending today, and good luck.